Hello, I'm Jeanette. I'm a physical therapist and I am presenting videos doing myofascial release self-care. My training is in pelvic floor physical therapy and the past 10 years myofascial release as taught by John Barnes. John Barnes's therapy is the best therapy that I've learned for the body in 30 years of being a physical therapist. It's so good that I was able to start a private practice very successfully just 2 years after starting to learn from him. Then this past year during the pandemic, I started doing online self-care sessions with groups of people, and I wanted to make some videos to make it more available to other people and more at people's own convenience. And the other thing I did during this year is I created this book, Myofascial Release for Women's Health, Self-Care. It has a lot of education about the body and myofascial release and such. It has general myofascial release techniques and then very specifically for private area for women, a lot of techniques. Now about doing these videos, some of the time we'll be in a position that's very much like a stretching position that you may already know, but we're going to be in them for 5 minutes. Sometimes we'll use a 4-inch inflatable ball like this, up to 3 of them. They are available for as little as $5 at a variety of websites. So if you get them, I recommend you get 3. And sometimes I use a strap. This is my favorite. It's called the stretch out strap. It's got these handles on it, but it can be anything that's long and stiff, like a belt or something. And then use your own precautions. If you have a condition like osteoporosis, or maybe you've had a hip replacement or a knee replacement or anything that's different about you, please use the precautions that you know you have and modify and be very careful. In general, if you feel pain or substantial discomfort right away as we start something, then that's too much. If you start to feel discomfort after a few minutes, that could be good. It could be that area in your body that has been stuck, frozen, solidified is starting to open, and the tissue memory there can be difficult depending on how the area became like that. And then I would ask you to please feel that gently, without judgment and without needing an explanation. And this self-care works best in conjunction with being treated by a therapist trained by John Barnes. And they reinforce each other, treatment and self-care. You can also do the self-care on its own. This is for you. I wish you the best on your continued healing journey, and thank you for watching, and let me know how it goes.